Hi everyone, welcome to this episode of Mary's Health Chat. It is time for some health chat. Let's discuss health. We are on the guest to guest segment and we have a phenomenal guest in the building. She's going to be tutoring us on the topic cervical cancer. She is a powerhouse in nursing field. She is a registered nurse, registered midwife, registered nurse educator. She has a BSc in nursing, a master's in midwifery. She's also a trailblazer as she's a registered ophthalmic nurse. She has certificates in family planning, manual vacuum aspiration. That's not all. She's also an award-holding lecturer in e-learning programs. Please join me as we welcome this special guest in the building. In the person of Mrs. Ngozi Akune Wariso. Welcome to Mary's Health Chat.
Thank you.
You're welcome, ma. Ma, what really inspired you to want to discuss about cervical cancer?
Okay, cervical cancer is a worldwide trending disease
Okay.
and which will be preventable if detected early
Oh,
and could be treated.
thank you. Uh, Being a worldwide health concern, can you break it down for us? What is this cervical cancer all about?
Okay, cervical cancer is a, a multiple cell division, is an abnormal multiple cell division that occurs in the cervix. And this cervix is situated in the lower part of the uterus. And this uterus opens into the vagina. And then this cancer of the cervix is usually caused by a virus known as the HPV. This HPV is the human papillomavirus, usually contacted through the sexual transmitted diseases.
Oh, okay, that is really interesting. And I hope the audience are on you and I want to know all about cervical cancer. What are the symptoms of this cervical cancer? Like, what will an individual notice in themselves to know that they are suffering from this cervical cancer? How would they identify it in themselves?
Okay. This cervical cancer could be noticed or observed, the symptoms could be observed according to the stages.
Okay.
Some stages could show with some kind of symptoms or some signs. And these include abnormal vaginal bleeding, painful pelvic pain,
Mm,
and some kind of bleeding after menopause,
mm.
or foul smell discharge, or painful pain during intercourse.
Oh. But please, can you tell us the common risk factors of this cervical cancer? People that are at risk of cervical cancer.
Okay, those that are at risk of cervical cancer include those that have a family history of cervical cancer, those that have multiple pregnancy, those that have multiple sex partners, and those that have partners that have multiple sex partners,
Okay.
those that have this papillovirus, especially the type 16 and then the 18.
Wow.
Those that are exposed to these contraceptive, especially the one that is inserted in the uterus, and those that have some, lifestyles like smoking.
Okay. Oh, thank you so much.
Thank you.
This is really interesting. For those living with this cervical cancer, those that are suffering from it already, can you please give them a list of treatment options that will help them?
Okay, for those suffering from cervical cancer, there are a lot of treatment options.
Okay.
And these treatment options include surgery,
Oh,
and then radiotherapy,
okay.
and then also chemotherapy. And this chemotherapy includes both injections and then tablets, as the
Okay.
case may be. And then in some cases, you could also combine both. That's the radiotherapy and then the
Chemotherapy.
chemotherapy.
Wow. What are the importance of this HPV vaccine? What's the ideal age to get vaccinated?
Okay, the importance of getting vaccinated for cervical cancer is it helps in the HPV vaccine prevention of the type 16 and 18.
Okay.
It also help prevent cervical cancer, especially when one gets vaccinated before the sexual intercourse.
Oh.
And the age for which is very good to get this vaccination is from ages 12 to 14 in female. And then it will surprise you also to hear that also men get vaccinated for this HPV
Really?
vaccine. Yes.
Wow.
Usually their own is around the age from the age of 9 to 45 years.
Oh.
It also prevents this genital wax annual. It prevents the genital wax
Okay.
cancer and annual cancer and then oropharyngeal cancer. And this
Okay.
oropharyngeal cancer affects the throat,
Oh.
the base of the tongue, and then the tonsils.
Oh. This is really, really, really interesting. You have heard from her. It doesn't only affect women, it can also affect men. Ma, please, what's your advice to the people watching us right now, our beloved audience? What do you advise them to do? And for people that are living with this cervical cancer, how can they cope both physically and emotionally with this condition?
Okay, the advice I would give to people who are suffering from cervical cancer include to seek early treatment, follow medical advices, maintain emotional support,
Okay.
and also family support and also group support.
Okay.
Eat well,
Mm.
sleep well,
Mm.
have kind of exercises, stay hopeful, have emotional support, go to a regular checkup like pap smear checkup, live a healthy lifestyle, and also take drugs that boost immunity and also fruits and vegetables that boost immunity.
Wow, this is so enlightening. Thanks for shedding light to this topic, cervical cancer. To our listeners, I hope you got value. Please stay informed, stay aware, and stay healthy. Don't forget to subscribe to our YouTube channel. Don't forget to follow us on all our social media platforms on Mary's Health Chat. I remain your nurse, your midwife, your reproductive health clinician, Romanus Amarachi Merit. Thank you for following us. Thank you for being part of this. Bye for now. Bye.
Bye.